The canus is attached to the tuberosity of the superior maxilla behind the last molar tooth and to the outer surface of the sockets of the molar teeth of the upper and lower jaw. This helps to keep food between the upper and molar teeth while the horse is eating.
The gluteus medius is attached to the lumbar and pelvic regions of the back, covering most of the ilium. This allows the hip to extend, which can be applied to rearing or jumping.
The masseter attaches to the zygomatic bone in the mandible in the horse's skull. Because it allows the jaws to come together and move side to side, it is the primary muscle used for chewing.
The superficial digital flexor is located on the back limb behind the carpus and cannon. Its function is to flex the elbow, carpus, and lower joints.
In horses, the trapezius muscle attaches to the cervical vertebrae in the neck, the thoracic vertebrae in the back, and to the scapula. The trapezius is responsible for raising the shoulder blade and moving the shoulder blade forward and backward.
The platysma muscle is found under a layer of skin on a horse's jaw. In humans, this is an important muscle in facial expression, but in horses, it helps get rid of flies by contraction of the skin muscles.
The quadriceps femoris originates from the ilium of the pelvis and the femur and inserts into the patella. This muscle extends the stifle joint and flexes the hip.
The sternohyoid muscle is a thin muscle that attaches from the hyoid bone to the sternum. The muscle acts to lower the neck down and depresses the hyoid bone, enabling the horse to chew and swallow.
The supraspinatus attaches the scapula to the humerus. It moves the shoulder forward, which allows for extension of the leg and is important for jumping.
The external intercostal muscles are found between the ribs and are responsible for forced and quiet inhalation.
The gluteus superficialis is located on the horse's rear and is regarded as one of the strongest muscles. It is responsible for movement of the hip and thigh. This is one of the most important muscles when it comes to trotting and jumping.
The rhomboidus muscle rests below the trapezius muscle. It attaches from C2 to T7. It helps pull the scapula up and towards the body and can also help move the neck when the legs are immobile when bearing weight.
The transverse pectoral muscle starts on the sternum but only cranial to where the sixth rib attaches. It also attaches to the humerus and acts primarily to pull the front legs in towards the body while it is moving.
The zygomatico auricularis is located at the anterior base of the ear. It is a small muscle that helps to move the ear forward.
The common digital extensor originates from the humerus and travels distally to become the common digital extensor tendon at the bottom third of the radius. It is responsible for extending the carpal, pastern, and coffin joints.